name is Sheree Solinscomb, and we're here today to do his head and neck assessment. The assessment is going to require physical contact. If you feel any discomfort at any time, please note. Any pain or tenderness, please note also. Okay, we're going to start out with the head. Make sure we note that the head is round and symmetrical to the body. We're going to go into the scalp, and we're going to make sure there's no lesions, no lumps, no bruises, and no tenderness throughout the scalp. And then we're going to go on to the ears. In the ears, we're going to use a pen light that we have. It's a small light. We're going to shine it into the ear canal, and we're going to make sure there's no irritation, no swelling, or no excess drainage. Now we're going to move on to the eyes, and we're going to look at the eyebrows to make sure they are in line with the face. We're going to look into the eyes also with our pen light. We're going to look at the sclera to make sure it is white, no irritation. We're going to look into the eyes to make sure there's no drainage. And we're also going to do perla. We're going to make sure that the eyes react to the light. And if you can look at the pen light for me, please, and watch it go out, and then in, and then side to side. All right? While we're here, we're going to look at the temporal pulses. Make sure that they are equal. And then we're going to do your temporomandibular joint. You can open your mouth, close, open one more time. Any restrictions? Close. Any pain or discomfort? Okay, great. Now we're going to go on to the nose. And the nose, we're going to feel to make sure there's no sinus pressure. We're going to tilt the head back. And we're going to look into the nose with the light. We're going to look at the mucosa to make sure it's pink and moist. There's no drainage out of the nose and no swelling. Put your head back down, please. And now on to the mouth. And in the mouth, we're going to ask you to open up your mouth. And we're going to look into the mouth to make sure that the buccal mucosas are pink and moist. We're also going to look for any tooth decay. We're going to look at the gums to make sure there's no scarring. Also look at the back of the mouth. Say ah. Okay, make sure there's no swelling back there underneath the tongue. Great. Pink and moist. Now we're going to make sure there's no tenderness throughout the head and the neck. We're going to move from the ears. Make sure there's no edema around the eyes, nose, mouth. As we're continuing, we're going to look for thyroid and lymph node swelling. Going to continue down, back up, make sure there's no abnormalities. We're also going to go to the back, make sure that we feel there's no tenderness. Okay, we're going to check the carotid pulses to make sure that they are equal. Okay, and now we're going to look at the Snell chart. We're going to check the eyes to make sure the vision. We're going to ask the patient to stick this piece of paper over the left eye first and read the Snell chart that is 20 foot away.
NBFEA.
Okay, was there any blurriness?
No.
Okay, on to the other eye.
NBFEA.
Okay, any blurriness there?
Nope.
Okay, great. That will give you 20/20 vision. I want to note that the patient does not have any contacts in at the time, no glasses, and no reading glasses. Okay, last thing we need to do is a range of motion of the head. If you don't mind sticking this ear to your shoulder, on to the other ear to the other shoulder. Put your chin to your chest, your head back, and do a full 360. Great. Okay, we also want to note that the skin is pink and moist throughout the assessment. And did you have any pain, any discomfort? No. Okay, the last thing that we need to do is to make sure that everything is in line. And we need to make sure that we have patency of the nostrils. You can breathe in and out for me, please. In and out for me, please. Okay, I believe that's it. Thank you.